Welcome back, everyone. If you suffer from neuropathy pain, then you know how frustrating it can be getting relief. Well, joining me now is Dr. Joe Dudorio, an author, clinical researcher, and president of the Neuropathy Treatment Centers of America, along with his patient, Rose Ballard. I want to welcome both of you to Sonoran Living. First of all, Doctor, let's start with you. You have some revolutionary breakthroughs in the treatment of neuropathy. Tell us about that.
Well, the idea of old-fashioned medicine is that patients, when they have nerve pain in their hands or feet and legs and toes, they're usually relegated to a life of, strong drugs. And that's really not the case with this modern care. We're actually using science to combat this type of chronic diseases.
Well, and that's certainly good information for those who are suffering from it. Tell me about this. You have a non-drug, non-surgical approach to treating pain from neuropathy. Everything that you work on is focusing on nerves.
Well, when you have neuropathy, that's actually damage to the nerves. So our idea is, why not work right where the problem is? Instead of giving you a pill that's just going to go and make you kind of forget about it while the problem is actually getting worse, we work right where the damage is, in the feet and the hands, to treat the tissues that are affected. Okay. When you have nerves that don't work, well, the skin is affected, circulation is affected, the muscles are affected, the joints are affected. And if you can direct your care to actually where the damaged tissue is, if the nerves get better, if the skin gets better, if the muscles can get better, what kind of problems are you going to have?
Absolutely. And before we talk about some treatments, let's talk about some of the symptoms.
Yeah, well, a lot of times patients will notice a tingling or a numbness, or like their sock is rolled up under their shoe, or they feel like they're walking on bubble wrap. People can have burning. Some patients can have ants biting them, or even things like restless leg or even balance problems can be going on when you have damage to the nerves.
And what causes neuropathy?
Well, in a recent study that we did, we found that the main causes were could be like chemotherapy or cholesterol drugs, post surgical problems, and the big one is actually diabetes.
Really?
So you have to kind of have a care that can address the individual problems of the patient. Not everybody's the same, so you have to have a care plan that affects the tissues that are damaged and gets them better.
Well, tell me, what do you do to help your patients and how you help Rose?
Well, a lot of the things that we do are actually to work with the nerves and the nerve damage. We want to increase the circulation, decrease the inflammation, allow the tissue, the actual damaged parts in the hands and the feet and the toes and legs to work better. So it's actually neuro-rehab to get the patient, the actual tissue, to work better.
I think we can help our viewers understand a little bit better. Let's take a look at this video. Can you kind of explain to us what we're seeing here?
Well, when the nerves slow down, everything slows down, and it's what runs your muscles and your circulation. So depending on what we find with the patient, what is the problem, we'll direct our care to the different tissues that are damaged. And that's why they can benefit from so many different of the therapies that we have.
I had no idea. I mean, I can imagine, the pain, and it's just something that just never goes away. At some point, Rose, tell me how's this treatment helped you?
I've been over a year with, basically, it started with a cancerous tumor and radiation, and they don't know if it was scar tissue, but it affected my sciatic nerve. I could barely walked with a crutch. My leg was very stiff, it was just awful. The pain is excruciating. I had a friend describe it like having a baby, but you never get over the pain and you don't have anything to show for it.
Oh, well, most of us can relate to that. Now, tell me how you're doing now.
Oh, much better. I was telling Joe that I got up this morning and got ready and didn't even think about a pain pill. And that's amazing for me.
That's great news, Rose. How long had you been taking pain pills prior to that and having to depend on them?
For a year.
Really? And you didn't even think about it today?
Didn't even think about it this morning.
That is great
I
news.
can feel my toes. I can feel the bottom of my foot. That sounds like a small thing, but for me that's a huge thing.
It certainly is. Dr. Joe, tell me about the laser treatment.
Well, the laser is one of the treatments that we use to kind of turn the nerves back on. make the muscles work better, increase the circulation, give back sensation in the feet and the hands. And if the problem is damaged nerves in your toes or the problems in your feet and your toes, go and directly treat the problem, you know?
Well, and what I think is important that what we're looking at here is that this doesn't hurt. This treatment doesn't
Absolutely.
hurt.
This is rehabilitative. This is the science and technology of helping nerves and muscles and joints work better.
Amazing, amazing information. Thank you so much for being here today, both of you, Dr. Joe and we just call you Dr. Joe. Everybody calls you Dr. Joe and Rose. Thank you so much for being here. Okay, we have a very special offer to tell you about now. For the first 25 people to call the 800 number on your screen, you will receive their introductory advanced neuro foot analysis for only $37. And this is a limited time offer. The phone number is 1-800-349-1526. And don't worry if you missed that. We, of course, have that on our website as well.